Welcome to True Wellness with Dr. D, the podcast where we explore what it takes to live with vitality, balance, and purpose. I am Dr. D, and each week I'll bring you powerful tools, inspiring stories, and expert insights to help you thrive in every area of your life. From health and wellness to mindset and navigating life's challenges, this podcast is your guide to creating a life of true well-being. Let's get started. We are committed to bringing to you new information, cutting-edge information about how you can take power and control over your health naturally. So I'm super excited to be joined by Dr. Gabrielle Pojero today. So Dr. Gabby, as I call her, is my chiropractor for almost the last 20 years. Yeah. Wow.
It's going so fast.
I know, it's like a blink of an eye, and we're still 21, by the way.
Yes.
So Dr. Gabby has adjusted all of my babies really like within their first 24 hours of life, because all my babies were home birth. And so Dr. Gabby and her husband, Dr. John, were right there ready for them as soon as we got into their office. But I'm really excited. So just a little bit background on Dr. Gabby. So Dr. Gabby has her undergraduate degree from the University of Arizona. She has a doctorate in chiropractic, which she received in 1996. And then she's also been a pediatric practitioner as well. She moved to New York with her husband in 1998, and that's where they started their family practice in the small Long Island town of Sayville, which was originally where South Bay Wellness was located. So, Dr. Gabby, we are so excited to have you join us today. I know there is so much to talk about, and we could probably talk for hours because we typically do. But I think there's lots of information that we can share with our audience today to bring some more recognition to chiropractic and the importance and value of chiropractic care, as well as, how that all fits into pediatrics as well. I know that is a strong area for you. So you guys, my family and I, we receive regular chiropractic adjustments. It's an important part of our well care. And so, Dr. Gabby, why would somebody do that?
So when I was young, I was 9 years old. My mom had a car accident, and we happened to be living in the United States at the time. I was a little bit of a back and forth Europe, United States. And my mom had such severe injuries from her car accident that she sought the assistance of a chiropractor, which I think most people would say, oh, that makes sense. An auto accident, chiropractic care. How wonderful was it that he was a family chiropractor? So what do I mean by family chiropractor? He is a chiropractor that sees the value in practicing in the way where he cares for the entire family for not only sick care, but really well care, which is such an important thing. And I'll explain to you guys a little bit more. Long story short, this gentleman did a wonderful job helping my mom achieve her health back. And he planted the seed and said, look, do you have children? And she said, yes, I have 2 girls. And at the time I was 9, my sister was 12. And he goes, I recommend getting your children checked for their spine check by me, myself as a chiropractor. And she did. And it turns out that I had a condition which a lot of people have heard of, scoliosis. And my mom never would have been made aware of this condition by any other discipline. So she received recommendations from this chiropractor. He started adjusting myself as well as my sister. She was having problems with her pelvis rotation. Very common for parents to see their children and their knees are facing the wrong way in or out when you're looking at them walking towards you. Long story short, we ended up getting adjusted. And because we were so young, it was even more beneficial to us. We hadn't reached our beginning of our puberty growth, which is a huge change in a person's anatomy. Our bodies healed phenomenally. I do not have scoliosis. It was a very straightforward result, and my sister doesn't look like anything. Everybody would think she was fine. So it planted the seed for me to become a chiropractor. And then fast forward, undergraduate studies. For some reason, I wanted to be healthcare. Found myself wanting to be a physical therapist. I was like, that's it. I'm going to get physical therapy degree in my master's program. It was actually only a master's at the time. Now it's a doctorate. Physical therapists can practice on their own. I did the beginning requirements for physical therapy and I went, whoa, this isn't who I am. This doesn't fit with what I'm looking to do. I want to help someone get well and stay well.
Yes.
And to me, physical therapy just didn't go there. It just didn't fit what I felt health was. And my friend who was undergrad with me goes, Gabby, why aren't you becoming a chiropractor? And I went, of course. I never looked back. Got accepted to the doctorate program in Georgia, ran over there, got my doctorate degree. And through that education, we were taught academically and philosophically the importance of chiropractic for wellness. And it's truly more important, I feel, for wellness than anything else. So how does chiropractic fit into wellness? It's about the nervous system. It's so simple. We try to be intimidated by how the body works, but the body works very straightforwardly. Whatever created us, whomever created us, chiropractors call it this innate intelligence, this God out there. It starts with our brain. Our brain is master control. We actually called it Nassau because at the time we were going to school, Nassau was big and Nassau was the headquarters and everything happened around Nassau.
Sure.
The brain uses wires to control our body throughout our entire body. The biggest wire is called the spinal cord, which can really be used to visualize it as like an extension cord coming down from your brain. That spinal cord is inside your spine, which is made of 24 movable bones called vertebrae. In between each vertebrae, as they articulate with each other, come out a pair of nerves from the very top all the way to the bottom, 24 levels. And they send this information from the brain to the body, controlling the body. And then the body's able to talk back to the brain using the same system of communication. It's this harmonious, beautiful balance. By the time we're fully grown, we've got 15,000 miles of visible nerves running our body. It's only 3,000 miles from your parents, and it takes you hours to fly there. So, Mother Nature knew what she was doing.
Yes.
This flow of communication occurs 70% of the time with us having no conscious awareness of it. For example, right now, my kidneys are filtering and producing urine. I'm holding a conversation with you. I don't care what my kidneys are doing. I know they're doing a good job. So 70% of the communication back and forth is unconscious. We're unaware of it. 30% of it is conscious, meaning I can hear you, I can hear myself talk, I can see you, I can smell, I can taste. I'm aware of myself on this chair sitting down. It's called motor and sensory. Through stress, what a big word, stress.
Yeah.
Generally, I explain stress in 3 categories: physical, chemical, and emotional.
Yes.
I'll give you some examples. Physical is always the easiest one for people to understand. I'm a mean sister. I push my sister down the stairs and she goes boom, 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 boom. You're going to realize, ouch, things are going to get hurt. And possibly you could understand maybe your spine might be affected by that. I'm in New York. I've seen police officers who go, oh yeah, I got pushed down the metro station, or I got hit by a car, or, it's all these crazy things. There's the micro physical stressors, our pocketbook over our shoulder, being stuck in traffic all day long, sitting in a car. Students, children, at a desk, staring at a teacher, staring at a screen, 45 minutes, you're up, a heavy backpack, go to the next class. So physical stressors are very easy for us to say, yes, that's definitely going to stress our frame. It's going to stress our body. Chemical stressors can be anything that can be from what we can control to we can't control. What can we control? We can stay hydrated. We can eat well. We can take our supplements when they're recommended to us because our body is deficient. We can avoid certain things that we know aren't good for us. For example, relating back to children, these young children are consuming a tremendous amount of of coffees and energy drinks. And it's a very popular thing right now. Limiting our diet to, again, just being, a little dramatic, but, chicken nuggets and French fries kind of a thing where your body is deficient in elements and minerals. And then there's the things we can't control. The quality of our tap water, the quality of our air, where we're exposed to through our foods is actually a big wake up about, food and how toxic it is. The fact that folic acid is in pasta. Why? Well, because it's in pasta. Why not put it in there? We don't need it. It's not good for us. And then there's another one, which is medications. Medications are prescribed. The reason that medications are prescribed is because they have the desired effect, and then they have a secondary effect called a side effect. And medical provider to be able to manage those effects, the positive ones and the negative ones. Those negative ones are considered a chemical stressor. I think, that puts a lot of on explaining what a chemical stressor can be. I always throw into all my patients, just because it's over the counter doesn't mean it's safe for you and effective. There's a lot to be said about Tylenol, Stephen Johnson's disease. There's also the fact that these non-steroidal anti-inflammatories, I think, are the third or fourth leading cause of kidney failure in the United States. That would be Advil, Motrin, all those. Definitely recommended for young girls with painful menstruation and women with headaches and etc., migraines, so on and so forth. And then the last one, which I feel is so important and we don't put enough emphasis on, is the emotional stressor.
Oh, it's a big one.
It's a big one. And now I have an easy example that I mentioned to all my patients. Go back to 2020. I think many of us in different ways were stressed in different avenues of our job, relationships, isolation, and we saw the stressors. I always use before, loss of a loved one, divorce, financial issues. You can see it in your friends. You can see it in your family members. Their skin color will change. Their eating habits will change. They all have problems sleeping, which is such an important part of life. They'll have a problem fighting viruses. They'll have chronic ailments, headaches, so on and so forth. All those stressors affect our spine. They affect the alignment of our spine. They weaken either directly or through micro traumas, the connective stuff that puts it in place and keeps it in place, which is muscles, ligaments, and tendons. By having those vertebrae go out of alignment, you interfere with that communication between the brain and the body the brain. It's like a kink in the hose. You're still getting the water, but you're not getting that full flow. That's called a subluxation. That is a word that is, it's a key part of what chiropractic is, because as a chiropractor, my job is to seek where the subluxations are. They can occur at all 24 of those levels, and very gently and specifically realign those vertebrae. And when we realign those vertebrae, we reopen that neurological channel and we allow the body to heal itself. And that's why chiropractic is wellness care, not care.
Yeah, I think that really sums it up, right? Because when our body's operating the way that it was designed to, right? When we can remove those subluxations, when things can flow as intended, then we actually have our well-being.
So what we were explained in chiropractic, and again, chiropractic education is the same as the medical education. We have the exact same classes. We take everything but pharmaceutical because we don't prescribe. We actually have more emphasis, and we take more hours on anatomy and physiology and neurology than most general doctors do, unless they specialize there after medical school. But we do take also philosophy, which is so wonderful. And when you look at disease, if you cut the word up, it's dis-ease. Ease is balance. Ease is harmony. So it's dis-ease, and that's all that it is. So that's why it's so important for an infant to have their spines checked by a chiropractor who, like myself and many of us out there, specialize in pediatrics all the way through adulthood and see, anyone at any age. Our youngest is a few hours old, and I can see a few hours old because there are parents who choose to come and see us as they come home from the hospital after the beginning of trauma, which is birth. Sometimes trauma is birth. And we very gently realign the vertebrae. Sometimes we check them and there's nothing to fix. But sometimes we check them and there's a very, very important vertebrae at the very, very top of your spine called your atlas, which is like a ring. It's like a circle. And it's very easy to subluxate when the OB assists the head in exiting the birth canal, or even during a C-section as they're going in and grabbing whatever extremity to have the baby come out. And that vertebrae left unattended and misaligned, it puts pressure directly on the brainstem.
Yeah.
Brainstem is part of the brain. It has very important centers in it. And so to have a chiropractor very gently with, literally it's just a slight touch, it's called sustained contact, which is really just gently placing your index finger on the back of your hand. And then that vertebrae just very gently just goes right back into alignment. That's it. This beautiful baby starts out with a well-aligned spine. And then it's endless, the possibilities. There are specific diagnoses that children have. If anybody could guess, if you ask any parent, what are the biggest ones? It's going to be, when they're infants and they're teeny tiny, it's going to be the vomiting, the colic, the spit out. That it's going to be that they're bound up, that they're not moving their bowels. It's going to be that they're cramping and in spasm after consuming breast milk or formula most often, but breast milk sometimes. And then it's going to be, it's going to be I apologize, I'm going to get rid of that right now. It's going to be more the ear infections, and then it's going to be the runny nose, and then it's going to be, then they're going to go on to saying, oh, they have asthma, which is one of the chronic ailments, and then I haven't heard anything too different. I have heard more as I've been in practice taking care of children, things that I never thought I would hear. There are new diagnoses constantly that are coming up, new abbreviations. I actually have a child who has fibromyalgia as a child.
My gosh.
Yeah. And I'm like, I'm sorry, what? Like that's an older, predominantly woman, predominantly involuntarily toxic woman disease. It's the inability to toxins in your body. So to have a 12-year-old be diagnosed with juvenile arthritis, I'd heard of, but now juvenile fibromyalgia, what's going on? And so again, so you seek back to, well, what's the most important thing? It's your nervous system. There are 5 factors of health, and you and I have discussed this many times because you're part of my health. It's going to be sleep. We all need to sleep.
Yes.
Quality sleep, quantity of sleep, different in different people. Ages. A newborn will sleep 23 hours. 23 hours. You know this. You've had 5 children, and then there's 4 children. I apologize. And then there's the senior who only needs 3 or 4 hours, and they're perfectly content. They're perfectly fine. Then there's going to be physical activity. An infant, they're not going to do much in the sense that they'll wiggle around. I do find sometimes and I don't know if this happened to your children or not. I thought this was kind of unique. It happened with my first, Alex. You and I were actually pregnant together for the first. And he just had, I called it the witching hour. He was about 3 months old and his spine was perfectly fine. He was breastfed. He was content. His diaper was dry. He just wanted to scream. He just is like, I'm good. I'm just going to verbalize my physical. Now I know him now as a 20-year-old. I understand why he's screaming. He's like 100 miles an hour. He's like an Energizer bunny. And then getting back. So then there's the sleep, then there's the physical activity. Obviously there is the nutrition, what we put in our body, a huge part of who we are. In the United States, this is, there's a big wake up call on what's going on into our body, what's going into what we have control over, what we don't, our choices, pick and choose. There's positive mental attitude, which is a big part of health. No one that's just grumpy is going to represent, the epitome of health. And then the last one is the nervous system. The nervous system, that's that brain, spinal cord, nerves that keeps everything in check and make sure that you're benefiting from everything that you're doing positively for yourself, your sleep, your positive mental attitude, your diet, your deficiencies. So I personally, and I understand I'm a chiropractor, so people would say that I'm biased, but I've lived it. I've raised my children with it, and I experience it every day. Children who are well aligned are generally healthier and happier.
Yeah, I think that's important to know because, I mean, Dr. Gabby, we're not talking here of, oh, my back hurts. Let me just go get an adjustment, right? Mm-hmm. Or I had a car accident. Let me go hit the chiropractor. We're talking about the importance of that spinal alignment for overall health in all different areas of health. And that does begin at that pediatric level. Like I said before, all my kids have been adjusted by you since, just a few hours of their entry into this world to make sure that they have the proper alignment. And even till this day, they are still continuously adjusted on a regular basis. And I think what you're saying is true because there's so many. All of the new childhood things that are popping up are mind-boggling. And we've got to start to look at the environment in which we're raising children in our world that's having these things come to fruition at such an early age. But there's even those earlier childhood things that are important that, I know if my kids ever complained of like any kind of ear pain, we'd make a trip to the chiropractor if they ever had any kind of congestion because, they're kids. They're supposed to be building their immune systems. They are supposed to have that, immune system practicing and building up. That's normal. They're supposed to get fevers. It's their body's sign that their body is working. But even constipation, right? You remember when those little babies, when they're not moving their bowels, they get a chiropractic adjustment and that stuff is right. It's the office.
Yeah, the poop, that's why we have such a beautiful bathroom with the little kiddie seat in the middle. So because as soon as you open up those nervous system channels, boom, the body's able to void that movement. It is such an important thing to touch into. Children aren't born broken. They're not, none of us are broken. There are genetic factors that play in, of course. I always tell people, so, it's mom and dad get together and it's like a big salad bowl and, you just mix everything together and then there's a genetic expression and that's who you are. So everybody will notice that, they'll say, oh, he's more like his father. She takes after me. It's always a funny joke of all their qualities are yours and then all the flaws are obviously your spouse's, which is, it's really funny. So, and then there's this expression of genetics. So yes, your child is more likely to respond to a virus in a similar fashion as yourself. For example, getting back to my history, I was a very healthy child, very, very healthy child. I was breastfed until I was weaned. I grew up in Europe. I was exposed to farm-raised meat, fresh fruit and vegetables. My mom made her own jam, her own yogurts, her own cheeses. She even made her own butter. It was just, the bakeries in France, they were just bakeries. There was nothing else in them. Yes, I still ate candy and so on and so forth. My husband was born in the United States at a time where Gerber had a huge marketing ploy where they advertised that formula was better than breast milk in the night. So not only was my husband born to a mom who had been, she actually was put under anesthesia while she was laboring, which meant that she was on her back and someone, most likely a nurse, pushed on her abdomen while her body was involuntarily contracting to get him out. She was unconscious. She was not helping. It's not like you and I, where we don't realize how traumatic birth can be. Right. So my husband was born in this fashion. My mother-in-law wakes up. She hears a screaming baby. She's like, oh, I feel bad for that, Mom. Turns out it was my husband. Poor guy. He formula feeds him because that's what she is led to believe. And she wants to do what's best for her child.
Yeah.
My husband was colicky. He was colicky. He was a rough baby. So rough that it took my father-in-law 7 years before he allowed my mother-in-law to have another child. So it was actually kind of a family funny. But anyway, from there, the colic didn't go away. It became something else.
Sure.
My husband had his tonsils and adenoids removed when he was 7 years old. That didn't take care of it either, because then my husband ended up with chronic bronchitis every year. It wasn't until he was in his very early 20s where one of his friends who was hearing him cough and cough and cough and cough said, "Hey, you might want to get your spine checked by a chiropractor." And he went, "What?" Because he again was misled to believe that it's just about it's about musculoskeletal issues, back pain, neck pain. He went to a chiropractor who educated on what chiropractic was, realigned his spine, bronchitis is gone. So children, and you made a very important point, and I love talking about this. You said it's so important for children to experience diseases at a young age.
Yes.
100%. You are correct. When do we want to learn the multiplication facts? We don't want to learn them in college. We want to learn them when we're young, and we want to learn them right. We don't want to say, "Oh, to learn the fours today, okay, let's go to the 20s and let's go." No, you learn them in order. Your body does that. And actually, it's beautiful what innate Mother Nature, whomever decided, because your immune system as an adult, you're exposed to virus A. Your immune system goes, "Oh, virus A, here we go. Let me make something to fight virus A."
Right.
An infant and a child doesn't do that. They have a non-denominational immune system.
I like that word.
Virus A, they already have something that's just broad spectrum that goes, wah, 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 wah. Done. It's over. That's why in a herd, we want the kids to go first. They're learning how to fight disease. They have a broader immune system, a non-limited immune system. They filter the nasty viruses, and then they expose the older people to the weaker viruses. Then we have probably been exposed to a lot of things where we have memory. And if it fits our memory, we can then match it. And if it doesn't fit our memory, we're making something new to something that's not as aggressive. That's called herd immunity. It's meant to happen through children. Children need to be exposed to things. I'm not asking you to have them lick the ground. I'm asking you to let them experience life. It was a big thing during 2020. People didn't socialize a lot. We recommended as chiropractors, keep your family with you. Socialize with a small group, but keep socializing. Don't keep it just 2, 3, or 4 people. The people that you really, truly trust and that you've always been around. It's not like we weren't socializing before, so it was just a little change because you want that exposure.
Right.
Grandmas and grandpas benefit from being with the grandchildren, assuming their nervous system is well, their spine is well aligned. Yes, I see grandmas and grandpas. Our oldest patient is 97 years old. Joan is now 97 years old. Love her, love her, love her. And their immune system is constantly being exposed to things to keep it tuned, to keep it active, to keep it, oh, wait, I can't forget, right? I can't forget. And so that's the harmony. And all that occurs with a well-aligned spine. So when you have a child who's exposed to a virus or a bacteria, and they start showing active symptoms, that's because now their body needs to develop a specific immunity, something that they're going to remember. And by going through it in a healthy, normal way, I use the word broadly, like you said, with a normal fever, a normal physiological reaction, when we are well aligned and we're not deficient in minerals or elements or vitamins, then they learn, they succeed, and then they get 100%. They get that grade A, and then that immunity stays with them in their memory cells, those memory T cells that we keep for life. And that's how we build immunity. If we never let it get to that point naturally, and we're constantly offering an artificial aid, how are we supposed to become healthy adults?
I think that's where we've kind of sidetracked as a society, right? We kind of want a Band-Aid over it, versus allowing the body to heal itself. And I think that's the beautiful thing. Like when you spoke about innate intelligence, it's like our bodies were designed ingeniously. They know exactly what to do. We've just lost that trust and faith because we've been told that, it's not about us. Right? I always joke, it's like when you go to the doctor, you're called a patient. Why? Because you're patiently waiting to be fixed. But in reality, right, nobody outside can fix. It's your body that heals itself. And the whole beauty of something like chiropractic and some of the other stuff that we spoke about, right? Nutrition and supplementation and stress management and sleep and all of that stuff. The beauty is it's allowing the body to do what it needs to do by taking those other stressors off the body so it can, do its job. But we've forgotten that as a society and a world. And yeah, I think 2020 was spotlight on that. It was the highlight of the fear that we have. And
it was very, you said it specifically, you said it right on, and I didn't mean to interrupt you. I apologize.
Good.
Because it's very passionate for you and I.
Yeah.
We are misled by a consumer society that your body can break. And the only way to fix it is to an artificial aid. But that's not the real story. The real story is that the only thing that can heal you, like you said, is your body. Chiropractors, we are on our soapboxes every day. I am not a healer. I do not heal you. I adjust the subluxation. Your body does the healing. Your body heals itself. And you are 100% correct. There is this huge awakening in the last 5 years. People have finally seen through these curtains and going, wait a minute. What truly heals me? How can I help myself heal? And that's why, I have patients just like you have patients who say, you save us so much money. And I go, huh?
Yeah.
And because you've educated us to be able to know what we need to do for ourselves that really truly give us results. So we're not constantly going and running over to the doctor for something we don't need them for. We're going to them when we truly do need them, which is what medicine is all about.
Right.
I'm in a car accident. I have a major laceration. I'd love for my husband to adjust me, but I'm getting to a hospital.
Yeah.
Like there's always a place for everything. But like you said, we have to get back to the basics. We in the United States, we are told that we have the best healthcare in the world. We're number 36 in infant mortality rate, meaning there are 35 other countries that are better off at keeping infants alive. I think, don't quote me, but I think if I saw the last number, we have one of the highest rate of post-maternal death.
Yeah, I think
a woman gives birth, they die. The highest rate. 52% of children in the United States today under the age of 18 have a chronic disease.
it's insanity.
It's 74% of the youth, the military age youth in our country cannot serve because of some type of ailment. We are broken. And now parents are seeking things that make sense, things that have been around for a long time,
Right.
things that go back to what can I do to help myself heal? Absolutely correct.
Yeah. I think you hit the nail on the head. I mean, these things we're as a society, we're getting worse, not better. As we step further and further away from the things that are natural, from trusting our body, from trusting, what nature gives us. And we move more and more to going outside of ourselves, to synthetic stuff, to pharmaceuticals, to, injections, to all of these different things. Now, our bodies are like, what the heck is going on? How do we expect them to function? It's a no wonder why we're seeing all this prevalence in all sorts of childhood illnesses and ailments. And let's not forget, ADD and ADHD and autism. Like these things they weren't even heard of before.
The diagnosis of the autism, we can talk about. Now we're going to talk about autism too, because you mentioned ADD and ADHD. Autism diagnosis, the way that we diagnose autism has not changed in the last 21 years.
Right.
But the rate of autism is 1 in 36. It used to be 1 in, I think, 18,000 or something like that. And when I was a child, it was unprevalent. I don't know if you heard what happened with Kellogg's. There are foods that have been slowly but surely, you swallowed. We all know who made it popular. It was Food Babe. This one woman who's like, I'm done. This is called informed consent. We have been blinded by certain parts of our lives that we trusted. We trusted that when we went to the store and we purchased things, we trusted that they were vetted. That they were vetted positive.
Right.
We never thought that it had anything to do with monetary gain. And I understand. Obviously, I want everybody, wants to be able to have a lifestyle that's supported by finances. I understand that's no judgment there. But here we are now in a society where I want everyone to question. When I have someone come into my office with a newborn and they take an hour of my time to ask me every single question of why their child, their infant, their premature 35-week-old that weighs only 3.5 pounds that I just started 2 weeks ago, why should I be adjusting Jordan? What's the benefit going to be there? I'm excited. I am excited because that is a parent who's taken it upon themselves to not just go, oh, someone else vetted that for me. They educate themselves. Through education is power. And that's what you and I do. We educate people, patients, clients on how to make better decisions for themselves. Because we know, you and I have lived this. We're raising children with this. We see this. We see these people who are chronically ill. A woman who had no bladder control and was told by a professional that it's because you're fat. And then I went, what do you mean? I go, you didn't just get fat overnight and you lost your bladder control overnight. So, what was the final straw? And, she'd lost her brother and her husband within weeks of themselves. So, the emotional trauma. She stopped drinking water because she was urinating herself. So she's like, I'll just stop drinking. You're totally dehydrated. So this is going to be, just a story I share. So what did I say? I said, I want you to go get the pens. I want you to go get adult pens. And I want you to start drinking like crazy. And I want you to come in every single day we're open and have your spine checked every single day. She ended up going on a cruise around Manhattan. She ended up starting to drive herself. She started traveling. That's life. That's health.
Right.
It's not symptom free. Symptoms they're just because your body can finally talk. How many times can your body be in a state of trauma and not talk? When, for example, pancreatic cancer, you become jaundiced and your eyes get yellow. It's too late. Did it talk before? I don't know. Could it have heart attacks? An example we always use. 3 out of 4 people pass away of their first heart attack. Did they know the day before? I don't know. So we can't go by symptoms. Stop thinking that getting rid of symptoms means you're healthy and not having symptoms means you're sick, because I can blow that theory out of the water. If you and I both go to a Chinese restaurant, or I apologize, we consume bad food. Let's just say hypothetically, I'm in the backyard. It's bad food. I go home and I am vomiting and have diarrhea all night long. And yet you're perfectly fine. Who's the healthier one?
Right.
Exactly. That would be the one whose body went, no, I'm not going to process all that. I'm getting rid of it. Is it pleasant? No, it's not. But it's part of being alive and healthy and well. And sometimes you need those symptoms to be able to say, hey, slow down. Your body needs its energy to fight a virus or bacteria. So you're not going to feel well. You maybe might want to take it easy. Maybe not go to work today. Maybe sleep. Maybe eat a little bit cleaner. Hydrate more. This is your body talking to you. Yes.
Yeah. I love it. What we're talking about is a paradigm shift, right? What we're talking about is shifting the paradigm from which people look at their health currently. Right. So they're looking at, I think symptoms can be a knock at the door like, hey, pay attention to me. Right. And they can also, like you said, we could also be in the space where we're not even experiencing symptoms. I'll have somebody come in and they're like, well, my health is pretty good. And they're like, but I'm on diabetes medication. I'm on medication for high blood pressure. I'm 50 pounds overweight. And I'm like, how do we define health when we can be on those medications, be overweight, not have energy, and still say our health is pretty good? This is kind of where we're sort of I'll call it disillusioned in our world and our society, and I think what's really important, and you alluded to this in what you were saying, is our ultimate goal should be to keep this gift, this vessel that we have been given as a gift, as healthy as possible so that we can live our lives, enjoy our lives, contribute to the world, make a difference. But it takes something, right? It takes paying attention to it. It takes those everyday things. I mean, most people wouldn't walk around and not brush their teeth every day,
But that's because the American Dental Association went into the elementary schools with Mr. Toothbrush and toothpaste and educated people on the wellness of having proper dental hygiene. And as you and I know, dental hygiene is related to cardiac health. But it's not like they went in with a heart, because they wouldn't have been able to see the bond between the two. But that's through education. And you're absolutely right that you said something very important. You said, health. What's Dorland's medical dictionary definition of health? It's a state of physical, mental, and social well-being, not merely the absence of symptoms.
Yes.
We get sick and we can take the lazy way out and go to a professional that gives us a diagnosis, which takes away our responsibility. Oh, no, it's not you. You have idiopathic hypertension. By the way, 75% of Americans will get idiopathic hypertension or hypertension, period. Why do we all have high blood pressure? Okay. Right. Thinking, well, maybe Dr. Gabby does, but I don't. So it's not about symptoms, because once you are given that diagnosis, you don't have to consciously be responsible for it anymore. You're given a solution for the diagnosis. So you're like, oh, well, it's got nothing to do with my lifestyle, how I live, how I eat, how I drink, my spine being subluxated. No, it's because I've been diagnosed with this particular condition, and the solution for this condition is this particular medication, whatever, surgery, so on and so forth. That is a quick fix.
Yes.
We're looking, like you said, long term.
Yeah. I always say we're kind of walking around as a society and as a culture, and we're just kind of putting Band-Aids over everything. And I always use the analogy, like if your check engine light of your car goes off and all you did was stick a Band-Aid over it, well, heck, your car is breaking down. And it's no different with our body. If we're not actually addressing the root causes, we're not actually taking care of that body, it breaks down. I mean, a car, you can buy a new one. With our body, we're done.
It's people coming in, and I know you have this because I have this, and I've loved this, and I've had it more in the last 5 years, is I'm sick and tired of being sick and tired.
Yeah.
And that this wake up call of, and it's never too late. Is it, getting back to children, having a healthy nervous system is key. It is the foundation for wellness. And making sure that their spine is well aligned is that. Even more so when they go through puberty, which is a drastic physiological and physical change for them. That is so, when they're subluxated prior to puberty, it's going to dictate their spinal alignment through puberty and into adulthood. And chiropractors have an expression, it's called, as the twig is bent, so grows the tree. You stand behind someone and their shoulders are like this, and they have a text neck is, a big one, or sports. We talked about children and sports. So you're supposed to have an ideal curvature in your spine. That curvature is dictating function. You have good curvature because everything's well aligned. You have great function. You have bad curvature because things are misaligned. You don't have good function. Doesn't matter how many times you massage it. Doesn't matter how many times you exercise it. It's not going to fix itself. So, and then of course is the lateral curve, which is called a scoliosis. So it is so imperative for young children to have a well-aligned spine pre-pubescent. And in through their puberty, which is when they play most of those sports, which is so wonderful for them. It teaches them a sense of belonging and discipline and teamwork and relationships and being able to multitask. It has so many benefits on so many levels, these team sports. But it's a stressor on their body. It's a physical stressor on their body. And so you maintain the alignment there, then you go on to adulthood. Why wouldn't you maintain your alignment through adulthood? Why wouldn't you maintain your proper nutrition diet through from infancy to death? Those are the things that you can easily maintain easily provide for yourself, that are accessible in the United States. That's where we benefit in the United States. We have access to all these alternatives. And, I don't know if it's true now, but when I graduated, the number one alternative to medicine was chiropractic. And so that's again, planting that seed and explaining to people, it's never too old. I had a young lady, her husband, everybody's young in my eyes. Her husband has Parkinson's. He's in his 70s. And I said, does he have a spine? Let's get him checked. And young children with diabetes 1, do they have a spine? Let's get them checked. Oh my gosh, their sugars are so much more easy to manage. And oh my goodness, he's a little cranky. He's a little ornery and defensive and a little, aggressive. Oh, well, let's get his spine checked. Oh, and by the way, what do you feed him? Is he deficient? Like that kind of stuff. So it's an exciting time. I feel even more exciting time now to be helping so many achieve wellness and health the way it was meant to be.
Yeah. I want to highlight one thing that you said here. And it's never too late, but it's also never too early. I think one of the other cultural beliefs is like, oh, they're just a kid. They don't need anything. Oh, they're just a kid. Feed them whatever they want. It's fine for them to have junk food and food dyes and they don't need to eat their vegetables. Oh, they're young. Don't worry about these things. But this is when it all begins, right? We want to lay that solid foundation so that child is a well adult. And has the opportunity to have that vitality and that longevity well into their future. And that starts with when they're young, right? It's not, I didn't just decide, oh, I'm going to go get my kids adjusted a couple hours after birth. It's like, no, I want to make sure that they are set up foundationally for the rest of their lives, for them to grow and flourish and thrive, and this is an important part of it.
Having practiced for the last 26 years in Long Island, I've come across people who come into my office for wellness care who say, my mom used to take me to Brooklyn to go see the chiropractor. Or even more exciting was, oh, my chiropractor used to come to our house and adjust us. You're absolutely 100% right. It's setting that foundation. The children are pliable. They are molded. They are highly, highly influenced by their parents and their surroundings. I have parents, when my children were in elementary school, my children read and they had great proficiency in being able to read material and comprehend it, knew what they were reading. And they're like, what did you do? What did you do? And I go, I read with them. So when they were young, I read to them. And when they had the skills to read, I read with them. Because why would my children want to read if they never see me read? Why would my children want to eat healthy if they never see me eat healthy? Physical activity, mental well-being. Well, do as I say, not as I do. That doesn't work. That's why, the dog isn't behaving. I don't know. It's not the dog's fault. It's, and that is, you're absolutely right. You show by example, just like you show your clients and your patients by example.
Yes.
It's the old 1980s, stoking a cigar and drinking a cognac with the big belly, chiropractors that, came about in certain times of our profession and stuff. They were fun. They were great. But, that's not what chiropractic is. And that's the exciting thing that you're right. You're absolutely right. Setting that foundation. We have been blessed. We've been in the same location for 26 years. We are not the only chiropractors that practice like this. I am telling you, we are everywhere. Seek us out. Find your referral. When you find that chiropractor, that's going to be your chiropractor, because the best chiropractor for you is the one that knows your spine. So when you come in and get an adjustment, they can go, oh, your body's going through something right now. Something's different. I can see it in your misalignment. Something's different. Take care of yourself, and they'll realign you. And then all of a sudden you'll be like, oh, I had a cold or whatever it was. And I've had the pleasure of taking care of families for years and years, and they don't come in for neck pain. They don't come in for low back pain. Right. They come in for wellness care and to chat and wellness care. And it's beautiful because that's, I think, how all of us should want to practice. It's just to maintain health. Yes, absolutely. Yes.
Yeah. And it is all about the maintenance of our health. It's all about our longevity. It's all about our quality of life, because isn't that what we're all looking for? To have quality of life, enjoy this precious time that we have on the planet.
Yeah, absolutely. I mean, the expression of ourselves, to have the best expression of ourselves and who we are. We are not broken. I will say it again. I'll reiterate it. We are not born broken.
Yes.
We get broken. Now, there are things we can control to avoid the break. And when it does break, there are things that are successful and truly work to fix that. It is never too late. I know you have it and I have it, where parents are now starting children before they start themselves. And this has been something that's been going on for some time, where, my child has an ear infection, I'm going to get them adjusted. And once they realize what chiropractic is, the whole family gets started. Right. And, it's a beautiful thing. And that's what it's all about. It's taking control. No one is going to do it for you. Let us not be a lazy society and think that someone else is going to be able to do a better job, because for the last 50 years, we've allowed someone else to do a better job. And we are now, as a society, broken. We are an embarrassment in regards to where we stand in world health. And we have, and I know we are starving for health and wellness, and we're all seeking for that. Yes.
Yeah. And it's time for us to take back power and control. And this is one of the foundational ways to ensure that we do that. So Dr. Gabby, what closing words of wisdom do you have for our audience?
I'm going to repeat myself, and I'm going to say again, your body heals itself. It has the power within it to heal through a healthy nervous system. Your innate can do amazing things. You deserve to be healthy, because with health comes happiness, and we all deserve to be happy, healthy and happy. Find that group. Actually, I'm going to say something. I don't remember who said it. I was listening to a podcast, and it was a politician. No, it was a journalist that was interviewing a very wealthy person. Like, my son would say a billionaire. That's, my son, he's that generation now in his 20s where, numbers count. And the journalist said, what is your biggest recommendation for success? And I loved what he said. He said, you need 3 things. He goes, you need a life partner.
For sure.
That makes sense. That's going to be there. Same views, same goals, same ambitions, same energy. You need a really good attorney that you can call at any time, and that'll give you honest and good advice. And you need that family doctor, the one you can call, that chiropractor, the one you can call at any time, where you can get the right assistance for staying healthy and well, that can guide you to where you need to go should there be any other need. That's what I want for everyone. That everyone have that chiropractor. How different the world would be when people got adjusted.
Yeah, I love that. Thank you so much for your time, Dr. Gabby. Can you just share with us a little bit about how our audience members can reach out to you and learn more about practice?
We are on Instagram and Facebook, Pojero Family Chiropractic. We're right on Main Street. Like I said, we've been there for 26, almost 27 years next year in March. We are, active on social media. Yes, feel free to call our office at any time. We offer free consultations, always free consultations. We're always available. So,
all right. Thank you so much for the gift of your time and your wisdom today. And thank you all for listening. This is Dr. D, reminding you to tune into your body, reconnect with what matters, and embrace the journey to true wellness. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who's ready to redefine their health. Let's keep redefining wellness and empowering change together. See you next Thursday for the next episode drop.